Tonight, the superintendent for Huntsville City Schools announced the deadline to apply for a virtual academy is extended until July 24th. That gives parents about 7 days to make a big decision for their children. Dr. Ali Hassoun, an infectious disease specialist at Huntsville Hospital, joins us now to talk more about the issue. Thank you for being with us tonight.
Thank you so much.
Let's begin with the risk factor. Are children really less likely to contract COVID-19 or merely less likely to show symptoms?
So it was thought initially that the kids will have less chance of getting the infection, but what we found actually the kids can get the infection in compared to the adults and the same percentage. The only difference is their symptoms will be different. In general, it's much milder symptoms if they get the active infection in compared to the adults. The main worry for the kids is the after effect of the infection. So there was, or there have been reports in, in New York, in Europe, about kids who get what we call multi-system inflammatory syndrome, which they can affect their heart, their kidneys. It can cause brain effect. So in general, they can have a mild symptoms, but there is worry the after effect of it can be serious.
Do hybrid schedules like students coming to school on alternating days actually minimize risk, or are they just a consequence of schools lacking space for appropriate social distancing?
So hybrid schedule, if we can or minimize the number of students in a way with physical distance and masking, it might help. My main worry is really for kids, these are very difficult to do, especially the elementary schools. It's very, very difficult to do. So I doubt as a practical method to do a hybrid kind of teaching unless we see a reduction in cases. And if we see a reduction in cases, it is, I think, possible. But for now, as we see the cases increasing, it's probably very, very difficult and not a good idea at this stage.
What are some of the symptoms that parents should be looking out for to determine whether their child has contracted coronavirus?
It's going to be similar to what we call viral illnesses of the upper respiratory tract, meaning they can have some runny nose, sore throat, fever, cough, aching, not feeling good. Younger kids, infants, they might stop feeding, they might have a rash. Older kids can have nausea, vomiting, diarrhea as well. So there's several things that can, or should make them suspicious of the possibility of COVID. Or it could be other upper respiratory viral illnesses as well.
What is the recovery time for coronavirus disease in children?
So in general, it's about 7 to 10 days. Usually the kids are much healthier, don't have much comorbidities, so in general it's much faster. The main issue with this comes up, even though if they recover, they can still be infectious to others for about 2 weeks around that, or sometime a little bit longer in some patients. So even though they recover, they cannot go back immediately to school as well. They're going to need to maintain quarantine till get cleared by their primary care doctor or family physician or pediatrician.
Anything else that would be important for us to know when it comes to our children and this new academic year?
Yeah, I think it's very important to try to educate the children about the COVID issue. The children usually are very smart about picking up information and knowing things. So we need to be open as parents, as family, to the kids and tell them why we doing, for example, washing hands, why are we putting the mask on, what's the reason of trying to avoid prolonged contact. It's very important to get the kids know these information. Even in a younger age, some of them will pick it up pretty good. And that actually can help between them because kids learn from each other as well. So it's essential that the parent be more open about what's the problem, what's going on, how to deal with it, and as much as the kids can pick up, it'll be good.
Dr. Lee Hassoun, Infectious Disease Specialist at Huntsville Hospital, thank you so much for your time tonight.
Thank you.